Nurses and staff at UVM Medical Center held a march and rally today in protest of program cuts announced by the UVM Health Network.
UVM Health announced those cuts last month as a result of a revenue cap put in place by the Green Mountain Care Board. Some of the cuts include closing the inpatient psychiatry unit at Central Vermont Medical Center, along with some primary care clinics in Central Vermont as well, and dialysis centers around the state.
Healthcare workers say these cuts could hurt the quality of care they can provide to patients.
We are opposed to these cuts, and we want these cuts reversed. Vermont does not need less care. We already know that we have a broken healthcare system where access to care is already difficult, and cutting these services and care to these essential areas is just not the answer.
The CEO of UVM Health Network said today that the service cuts are not moves the network wanted to make. Sonny Eapen told NBC5 News that the decisions were painful, but said he and others had to make them in order to comply with revenue reduction orders from the Green Mountain Care Board. Moving forward, Eapen said the network wants to be a central part of the high-level conversations about improving the healthcare system for everyone.
I think what we really need to do in our state is come together without finger pointing, without good guys and bad guys, and really try to solve the issue of how do we deliver greater access to a group of patients who are older and sicker in a situation where costs are high. And that's the reality. And instead of finger pointing or finding out who the bad guy is or pointing fingers at the good guys and bad guys, it's really about us coming together and working together to find solutions.
Eapen says the network has been in close communication with state lawmakers and the Care Board to discuss ways they can work collaboratively to ensure high-quality care is available in an affordable way.